Hello everyone, welcome to New Roots Hair Transplant Clinic once again. So today we are going to talk about a topic, a very informative topic about illness and hair loss. In general, COVID-19 and hair loss. Since we are in such a situation of pandemic, COVID-19 is the first thing that comes to mind. Now, talking about illness, be it any illness that you get infected with, either typhoid, malaria, dengue, or any other illness, febrile fever, whatever, even COVID 19, your body will undergo stress, which will again cause immunity reduction. Once the immunity goes down, the body goes into a haywire condition. Your dietary factors are changed, your diet reduces, weight loss occurs, fever is prolonged, stress is induced. All these factors together cause a situation that a patient undergoes hair loss. Now, this hair loss is not permanent. So, once when you get treated for the disease, your body gets back to the normal condition, it gets back to the healing process, your hair will also start healing. As in, when the hair loss occurs during any illness, the hair usually sheds off. It breaks off from the shaft, but the root is still present behind. Since the root is still present behind, the hair grows back again from the root and you again get your hair back. Now, in situations like COVID 19, where the patient is under stress and prolonged reduced immunity plus fever is prolonged till 7 to 8 days, maybe even till 15 days, or in typhoid, when it is undiagnosed, the fever is prolonged even for 1 month. But in such conditions, we cannot expect hair to grow. Since the nutrition is decreased and fever is not being a normal condition of the body becomes hostile, and it is a defense mechanism of the body to fend off the virus or bacterial infection, whatever it is. And after that is done, the hair can start to grow back. The building blocks of the hair or the body starts to begin. The repairing process starts to begin. So, after an illness, if a patient undergoes hair loss, he should only remember that it is temporary, it is a shedding. It means that telogen effluent phase has been prolonged. Now, I'll talk about the treatment aspect, like how do you combat it. There's nothing in that basically. You have to take care of your diet, include more of green leafy vegetables, include more of iron rich diet that consists of walnuts, apricots, badams, pistachios, all the dry fruits that you can think of, you can have those. Try to increase your hemoglobin levels if it has reduced. Then, along with that, you can supplement your diet with nutritional deficiencies like omega 3 oils. Then, you can supplement them with natural foodstuffs like chia seeds, palak leaf vegetables, and broccoli. So, these are the dietary aspects of the points that you should look into. Now, after that, you should also supply your body with nutritional supplements like multivitamins, biotin, zinc, folic acid, and so on, even including calcium and vitamin D. So, after this, the another point that comes to mind is, does a patient after hair transplant undergo hair loss during COVID 19? Yes, he will undergo hair loss because his body is under stress, but it will not be a permanent hair loss, it will only be shedding phase. So, those hairs will regrow again in a month of 2 to 3 months. Now, coming back to the other things, emotional stress, depression, and anxiety, plus weight loss will also help in the shedding period to be prolonged. That is the telogen effluent phase. Now, once we have recovered and our body has taken over and we have started a proper diet, exercise is one of the main things that a person should look into. Cardio, including weightlifting, yoga, then includes breathing exercises, and try to keep yourself stress free and try to gain your immunity back. So once your immunity is back on top and your body is again back to normal, you will be back to normal and on the path to recovery of hair loss. So that's it for today, and thank you for watching the video once again.